Naltrexone or Revia or Vivitrol. What is it? What is it used for? What do you need to know? To our handy whiteboard we go. So, naltrexone is an opiate antagonist that is used to treat opioid and alcohol dependence. So, the two name brands that I have listed here, Revia, this is a more short-acting form of naltrexone that must be taken daily, whereas Vivitrol is a long-acting form of naltrexone that is given via IM injection, and it lasts for 28 days. So with Revia, you're going to start to feel the effects within 15 minutes, whereas with Vivitrol, it's going to be about 2 hours because, again, this one is long acting and you only have to have this injection once every 28 days. So our mechanism of action here with naltrexone is that it blocks the effects of opiates like fentanyl, heroin, by binding to the opiate receptor sites. So in essence, it competes with those opioids for the receptor sites in order to block the feelings that opioid will give you, including those feelings of euphoria, sedation, analgesia, and especially respiratory depression. So it's important to remember that, yes, while naltrexone is considered a drug that treats psychological opiate dependence, it is also very useful in treating alcohol dependence disorders because Vivitrol, especially because it's a once a month injection that has lasting effects for 28 days, actually has been very effective in reducing the cravings for alcohol. So comparison, the drug that we just talked about, antabuse, is an alcohol deterrent, whereas naltrexone treats alcohol cravings and combats alcohol cravings. So actually reducing a person with alcohol dependence disorder, reducing their need or their want for that alcohol because it's going to block the effects of feeling drunk. So what are the side effects we need to teach? The most common side effect is going to be injection site reactions, and that's with Vivitrol because it's an IM injection. So that's going to be redness or erythema, tenderness, swelling at the site of injection. And this is something that the patient needs to be taught to expect. GI upset, anorexia, and anxiety are all included as possible side effects that your patient needs to be made aware of, and they need to not freak out about these side effects if they experience them. However, on the flip side, our adverse effects are induced opioid or alcohol withdrawal, which is bad news. So why would this happen? Why would an induced opioid or an induced alcohol withdrawal syndrome occur? Well, it would occur because naltrexone basically has a stronger pull to the brain's opioid receptor. And so that means that when it enters the brain, it will basically knock out other opioids such as heroin or fentanyl or alcohol that are sitting there at the brain's opioid receptor, which is going to cause the patient to rapidly enter an opioid withdrawal syndrome. Opioid alcohol withdrawal can absolutely kill a patient because basically you are totally reversing the central nervous system depressive effects and sending the central nervous system into a situation of absolute overactivity, tachycardia, hypertension, diaphoresis, deadly cardiac dysrhythmias. So this is something that absolutely needs to be avoided with this drug. So how do we do that? So in order to prevent this very potentially dangerous opioid or alcohol withdrawal syndrome, the patient has to be opioid, alcohol free for at least 10 days prior to starting the drug. So that means the patient's got to be completely honest with us. When was the last time you used? When was the last time you drank? And you've got to be honest with me about this because your life depends on it. This also includes tramadol when we're asking the patient about previous opioids or previous alcohol usage. So, some other adverse effects we need to teach the patient to watch out for: always hepatotoxicity. So, yellowing of the eyes or skin needs to be reported to the provider. Obviously, any suicidal thoughts. This drug actually has the potential to induce an eosinophilic pneumonia. So, any new shortness of breath or dyspnea needs to be reported to the provider as well. And so finally, down here on our testable content, remember we said that naltrexone is used for psychological opioid dependence. It blocks the effects of opiates by binding to opiate receptors in the brain. And the most common adverse reaction of Vivitrol, which is the long-acting IM version of naltrexone, are those injection site reactions like the tenderness, the redness, the swelling, the warmth at the site of injection. Hope this has helped clear up any confusion about the drug naltrexone. Keep studying, keep working. We're almost at the end. Happy semester, and go Vols.